work upon. Good afternoon. This is Dr. Bhupesh from Dr. BK Moit Institute. Just covering this role play in the best possible way. Will not take much of your time, guys. I understand that we have to cover the class. It's a very simple role play. When the patient comes to accident and emergency department, most of the times we tell you guys that first of all, don't ask questions. First of all, provide the treatment. But in this particular kind of role play, if you will see, it is given that you are a nurse and the patient has just arrived after sustaining a severe injury. You are taking down the details of the incident. So we are taking down the details of the incident before explaining the treatment plan. So in this particularly it is given. Otherwise we normally say in all the accident and emergency cases, first of all treat the patient. Means suppose if patient has come with a severe burn, first of all I would like to clean and dress the wound. So maybe the burn is not that big that we have to worry. It's just on the right hand. Maybe that is why the reason. But otherwise in accident and emergency department, never kind of ask questions first. So you say, good morning, my name is Bhupesh, I am a nurse over here in this emergency department and I can see you have a burn on your right hand. Could you please tell me, first of all I need to give you first aid treatment for the same. You have got the burn, so first of all I am just going to clean this and will apply the alginate dressing over the wound. Okay, so now I have applied, present perfect. Now I have applied the dressing. So would like to ask you a few questions. I hope you are okay with it. Yes, nurse. Okay, first of all, I would like to know about how this injury occurred. And then also I would like to know about the pain level, that if I give you a pain scale, if 0 is for the minimum pain or no pain and 10 is for the maximum pain, how much pain do you have? Can you tell me in numbers? Nurse, I am having 6 out of 10. Okay, so you are saying you are having kind of a moderate pain. Don't worry. You will be given the painkillers for this. So there is nothing to worry. Whenever you will be discharged now or whenever you will go home, we will provide you the painkillers. Apart from this, as I have done one of the alginate dressings, these are kind of the soft seaweed material which is normally used on the burn. So this dressing has to be changed every day. So I would request you to come to the burns clinic or go to the burns clinic to get your dressing changed every day, because accident and emergency department should be in the hospital. So you should go to burns clinic. So that is the point. Means if you are the burn clinic, you will say come to burn clinic, but I think accident and emergency department should be in the hospital. So you will say, and you need to go to the burn clinic to get your dressing changed daily. And further, I would like to notify you that it will normally take around 2 weeks to heal, and you will not be able to work during this time. I hope you are okay with it. Yes, nurse, I'm working at a cafe, and that is where this incident happened. Yes, exactly. That is what I'm trying and tell you, Mrs. Maria or Miss Maria, that you will not be able to work at your cafe during this time because it will take at least 2 weeks to heal. And in this particular duration, you should not do any kind of work. Are you okay with it? Okay, nurse, I will try and follow. That's great. You should follow this. Further, I would like to tell you that you need to redress your wound every day to prevent the infection and also to ensure that healing is occurring properly. And the most important thing is that you cannot be around the food preparation. So again, that is to tell you that please do not go to your cafe and you should not be around the food preparation even at home. So try to stay away from any kind of heat and also from water to prevent any kind of infection so that your wound can heal properly. So are you understanding me, Miss Maria? Yes, nurse, I'm getting your point. That's great. Okay, then, and last, recommend speaking to a doctor about the medical certificate. Okay, so nurse, can I get the medical certificate? Of course, you can get the medical certificate as you cannot go to, but I would really request you or recommend you to speak to the doctor regarding the same, because I am unable to write one. Being a nurse, I'm not the authorized person to give you the letter for as medical certificate. So you have to get this formal letter written from doctor himself, and he will give you that medical certificate. Okay, nurse. Okay, then now I'm leaving, and doctor will come soon, and he will also take care of you. And if you want medical certificate, you can talk to him. And rest, your wound would be fine within 2 weeks. Now you are out of danger. There is nothing to worry. Your hand is absolutely fine. Of course, there are burns, but that will heal with time. But otherwise, you are fine, and you are going to be very fine within 2 weeks. Okay, nurse. Okay, then take care. If you need anything, you can press the buzzer and we will be here to help you. Simple means you don't have to worry. Every line doesn't need to be specific. You just have to perform in the best possible way. This is Dr. Bhupesh from Dr. BKM OIT Institutes. Our contact number, as you all know, is 76967 34256. And please subscribe our channel if you have not, for your own good. When it comes to OET preparation, Dr. BKM obviously is the best. Thank you very much.